Hello, my name is Brittany Clensar. I am in Group 4 for this debate and support that a single-payer healthcare system will cure most ills of the United States' current healthcare system. So for starters, it's important to differentiate what a single-payer system is in comparison to the current insurance system in the U.S. So the U.S. health system is a mix of public and private, for-profit and nonprofit insurance and healthcare providers. The federal government provides funding for National Medicare program for adults age 65 or older and some people with disabilities, as well as for various programs for veterans and low-income individuals, including Medicaid and the Children's Health Insurance Program. States manage and pay for aspects of local coverage and the safety net. Private insurance, which is the dominant form of coverage, is provided primarily by employers, and these public and private insurers set their own benefit packages and cost-sharing structures within federal and state regulations. In a single-payer healthcare system, rather than multiple competing health insurance companies, a single agency takes responsibility for financing healthcare for all residents. Everyone has health insurance under one health insurance plan and has access to necessary services, including doctors, hospitals, long-term care, prescription drugs, dentists, and vision care. Individuals may still choose where they receive care under a single-payer healthcare system. So before explaining why a single-payer healthcare system would be more beneficial, I will identify the current weaknesses of the U.S. healthcare system. First, according to the 2017 census, 28.9 million Americans were uninsured, with the United States being the only developed country that does not offer its citizens healthcare. This is a current weakness that could be addressed by a single-payer system that extends care to all. This lack of health insurance coverage has a profound impact on the U.S. economy. The Center for American Progress estimated in 2009 that the lack of health insurance in the U.S. cost society between $124 billion and $248 billion per year. The low-end estimates represent just the cost of shorter lifespans of those without insurance, and the high end represents both the cost of shortened lifespans and the loss of productivity due to the reduced health of the uninsured. The cost of care for citizens is also a significant weakness of the current healthcare system, with the diagnosis of a serious disease or even an ambulance ride leaving a person with crippling debt or forcing them into bankruptcy. A study conducted in 2009 revealed that 62.1% of the 1.4 million bankruptcies filed by families that year were linked to illness and medical bills. And of those that filed, 78% possessed insurance at the onset of their disease. It does not seem logical to continue with the current system that essentially punishes individuals with the onset of a disease. And not only are American citizens paying astronomical prices for care, the US is as well. In 2017, the United States spent about $3.5 trillion or 18% of the GDP on health expenditures, which was more than twice the average among developed countries. These expenditures can't even be justified by better health outcomes, as the United States rates poorly in infant maternal mortality, deaths resulting from asthma, and poor kidney and liver transplantation outcomes. So as you can see here, this graph shows spending per country on healthcare, and it is clear that the United States spends a significant amount more. However, many of the expenditures were in areas that could be reduced if the United States abandoned the current healthcare model. For example, currently, administrative overhead consumes 31% of every healthcare dollar spent in the US. These costs could be drastically reduced if physician reimbursement and the need to generate these itemized billing for each individual patient regarding what the insurance companies will cover or won't cover will be eliminated. Instead, through a single-payer system, there would not be this need for the itemized billing that haggles with insurance companies, and physician reimbursement would be much simpler. By eliminating this bureaucracy, these resources could be allocated to providing coverage for all. So the benefits of a single-payer system include that with such a high uninsured rate, a single-payer system would essentially cover all and eliminate that problem. The expansion could also result in better health outcomes, as citizens will have access to preventative care. And through a simple physician reimbursement and administrative changes, the maximum amount of healthcare expenditure allocated to these areas could instead be used for healthcare on individuals. Just to continue, the single-payer system also has more incentive to direct healthcare spending towards public health measures. So since many Americans suffer from chronic diseases, more resources would be allocated towards preventative behaviors that can help combat these diseases. In the current system, private insurers and pharmaceutical companies benefit from these chronic diseases that cost citizens a large sum of money. There also would be more trust in the physician-patient relationship. Patients wouldn't be forced to go to specific providers who may have not been their previous doctors, and they wouldn't be required to switch providers when, say, they would change employers or their plans change, so they can actually build trustful relationships with their doctors. A single-payer system Also helps combat fears people may now have when they are faced in pandemic situation when quarantine results in businesses closing and thus ending their insurance coverage. Without tying insurance coverage to employment, as many industries do, such as the restaurant industry, it also allows for a more equitable system. So I wanted to briefly address how the current healthcare spending is justified. So I had previously mentioned that administrative overhead consumes 31% of every healthcare dollar spent, and this is due to the bureaucracy involved in physician reimbursement. I want to expand that under a single payer system, physician reimbursement will be much simpler. And there was actually a recent study that found that the United States spends 4 times as much on billing and administration per physician as Canada does. So we could even follow a system similar to that. And in 2013, the US spent $1,112 per capita on pharmaceuticals and other non-durable medical care, which was more than double the OECD average of $515. While the case is made that this expenditure is necessary for innovation, a study conducted in 2017 found that of the 46 new drugs that year, 17 drugs, which was nearly 37% of all those approved, offered little or no added benefit. So who is this innovation benefiting, the corporations or people? So if you're not living in a box, it's evident that there is not mutual agreement regarding a single payer system, with many negating healthcare expansion because of fiscal concerns. While it will initially be costly to expand coverage to all through a single payer system, a systematic review of 22 economic analyses revealed that 86% of the analysis estimated that healthcare expenditures would actually fall in the first year, and all suggested the potential for long-term cost savings. These reductions will likely be from slashing administrative and drug prices. And further, while many choose to focus on the increase in taxes, if the current insurance premiums that people often pay through their employers are viewed as a tax, US citizens already pay more than other developed countries. Many also use the argument that the expansion of coverage means that Americans will be forced to have these extended wait times to obtain treatment. And this argument is actually pretty misguided. So first, wait times are comparable in the US to other countries, with US citizens actually facing longer wait times for non-emergency surgeries and special appointments. So in the US, wait times are actually dictated by location. And when you look at the Medicaid expansion in Massachusetts, which is currently the state with the smallest uninsured population in the US, these citizens face slightly longer wait times in the short term following expansion, but when the rest of the country saw increased wait times in the year following, Massachusetts actually saw the opposite. So this suggests that the impact of health coverage expansions diminishes over time as the provider supply rises to meet the new demand. So transition to a single payer system will be difficult, as those in opposition are very powerful entities, including health insurers, organized medicine, and pharmaceutical companies who are powerful lobbyists, but the expansion to a single payer system is necessary. 59% of the physicians in the US acknowledge that their patients have difficulty paying for care. And in 2013, 31% of uninsured adults reported not getting or delaying medical care because of the cost. This is compared to 5% of privately insured adults and 27% of those on public insurance. So by looking at these statistics, it's evident that health outcomes will improve if citizens are actually able to seek medical help without financial burden. And under a single payer system, the wasted costs of administrative spending will be ended. A single payer system can help cure the current flaws of the United States healthcare system, as access to medicine should not be a luxury. Thank you.